All right, back here at FFAS 2018, I'm joined by Dr. Khoobehi from New Orleans, or Nolens. New Orleans. I got to get that down. Thanks for joining us. How's the show going?
It's been great.
Awesome. So you were speaking or moderating?
I had a talk Thursday.
Okay, talk to me about that.
And my talk was about fat grafting,
Okay.
combination of the face procedures. And that's a kind of procedure that's dear to me because I look at the aging is not just that sagging. Aging is multiple things. Just the skin gets saggier, skin loses elasticity, you lose some bone. So you cannot just by lifting it give a good result.
Right. That's interesting. So yesterday I learned for the first time that the bone density is losing as well as you age.
Correct. It's not just one thing.
Yeah.
So if you just approach it with the aging, anti-aging, just by lifting it, by cutting it, you're not going to have a good result. That's going to give that more artificial, more surgical look.
Right.
So we approach it with just combination.
Okay.
Laser surfacing, fat grafting, and the lift to give more natural results.
Beautiful. Okay, so tell me a little bit more about your experience here. What were some of your favorite sessions that you obviously the one that you weren't presenting on?
This session's been to multiple talks, and one of the great things is just how to really learn from the best in the fields, from different fields, from the dermatologists, from the facial plastic surgeons, and from the plastic surgeons, from your colleagues, how to provide the best care to our patients.
Sure.
Not only just that quality of it, but also what is the safest, newest techniques.
Yeah.
And you can always learn. I mean, the one thing is in patient care is that it's always a day to learn, and we call it practice. It's just you learning. It's not that one thing that you just stop and okay, I'm the best, and that's it. You continue every day. You learn. Right,
which is a cool thing about this meeting is and going along with that learning is they're talking about, an emphasis is the complications, right? A lot of them are talking about the complications so that you can learn from each other and learn from each other's mistakes.
Talking about complications is a very important point because you rather see other people's complication.
Yeah.
But also how they take care of it.
Sure.
So unfortunately, if something happened and you have that complication, you know better how to do it, how to take care of it.
Right.
And also when you're learning how to that happened, and you learn also how to prevent it. So what to do to not be in the same situation.
Right.
Like about injectables, where to inject, not to inject, about the surgery, where to make a cut, not to cut, or also patient selection, which is very important.
That's the beautiful thing about medical versus other career choices or industries is that mentorship part of it is very explicit in your guys' career versus other ones. I wish in my career I had that constant mentorship,
Well, that starts from our teaching residents.
Right.
I mean, we open our practices. I teach students and residents from the LSU and Tulane. And they come to the practice and they can see everything I do from practice part of it, how to manage a practice, but also how the patient care, surgical care, aftercare.
Yeah.
And it is actually beneficial both ways.
Yeah.
And the residents that learn, but also at the same time I learn because when you teach, you always learn too.
Of course, yeah. Beautiful. So let's switch gears a little bit. Tell me a little bit about your practice.
I have a practice in Metairie, and I'm fortunate to have another associate, Dr. Walters.
Okay.
He's a plastic surgeon too. And we also have a dermatologist, and Dr. Mai, and that provides us with the kind of global approach. We share questions about patient care. We have a difficult case. We kind of go back and forth. He's younger, I'm a little bit older, so I have the experience, but he has also more exposure to new things.
Okay.
And Dr. Mai also brings another aspect to the practice, which is the dermatological, and also we have some situations that involve more skincare and everything. We refer to her to take care of it.
Cool. What's your favorite part about practicing?
Really, one of the best part about the practice is that how that with this small procedure and everything, you change a patient's life and how they different. For example, I had a young lady that she was 17, and when she came to my office, she had a small change, a little bit fat in the neck, and she tried to avoid that. She was kind of more bent down, and we did a small procedure, chin implant, neck liposuction, and it was amazing thing was that when she came afterwards, she was just like a florist. She just opened up. She's more proud. She's sitting up. Her mom said that it was amazing thing is that how her attitude has changed, how strong she feels about herself. And plastic surgery is not for everybody, but in the right place, it really can help the patients feel good about themselves. When you feel good about yourself, other people treat you better.
Right.
And some patients, like the little kids that they come in, 9-10-year-old, and they have a prominent ear.
Yeah.
Okay. And the kids, other kids, pick on each other. They're like a pack of wolves, and when they see a little bit weakness. So helping that kid so feel no different. And just a little procedure, tuck the ears, they feel that kid feel more comfortable, and that's what it's all about.
Right. Beautiful. Okay, last question. Where do you see, I know the second track here at this meeting was non-invasive and fillers. Where do you see the industry going, this aesthetic industry going in the next, 5 to 10 years?
Regarding that non-invasive procedure, it's amazing how it's kind of exploded. And every year, the number of Botox and neurotoxin, neuromodulators cases increases, fillers, and become better fillers. And really, it's impossible to see how it's going to be. Because it's unknown.
Right.
And
everything's moving so fast.
Yes, the most important thing is about the patient care, and the patient really tell us which way to go.
Sure.
We cannot dictate our patients what to do. We have to get the feedback from them, what's more important.
That's a good perspective, yeah. Awesome. Cool. Well, thanks for joining us. I really appreciate it.
I appreciate it.
Have a good rest of your meeting.
Thank you.
Yeah.